Some parents are opting out of vaccinating their children, and oftentimes that means they won't be accepted as patients by many pediatricians and primary care providers. That is not the case at one practice in the Hermitage area. We spoke with them about why they embrace parent choice. At Hopewell Family Care Integrative Medicine, they approach healthcare a little differently.
This is my mission. This is my purpose on earth. And I really love the people of Middle Tennessee. So we spend more time and we really listen to the patient's story. And that is like where you find the gold nuggets and the cues and the clues into like their health. We do a lot of root cause medicine. And when needed, we add allopathic medicine to that as well. So, integrative care means we are doing both.
Jamie Arroyo is a board-certified family nurse practitioner and co-owner of Hopewell. She started the practice, she says, to fill a need in the community: holistic, personalized care and patient choice, including when it comes to vaccines. It started small and now serves 12,000 patients.
We definitely have a mixed group here in our practice, and all are welcome. So we have patients who have the full schedule and some who have chosen certain products, and then some who have felt like due to family history and child genetics that it's not a good fit for them. Some parents will just refuse the schedule or defer it entirely. They still deserve some place to go. Like, those kids need to be able to be seen somewhere.
Since the pandemic, Arroyo says parents are questioning vaccines more than ever. As a mom of 5 herself, she understands and says each of her children have had different vaccine schedules. The providers at Hopewell have conversations with the families in their care about their unique circumstances and preferences.
We do present the CDC schedule, but then we also present a lot of education as well. And that includes the inserts from Merck themselves, the actual vaccine manufacturers. So none of this is coming off of like some crunchy website. This is exactly what the CDC puts out.
Arroyo points out that even though vaccine skepticism may be on the rise, it hasn't translated into any major changes in vaccination rates thus far. The Tennessee Department of Health tracks the percentage of children receiving the CDC's full 7 vaccine series. Immunization rates dropped slightly from 78.84% in 2019, before the pandemic, to 77.06% in 2022, the most recent year reported. Arroyo's goal is to treat patients not like statistics, but as individuals, and to ensure that parents have a say in their child's health care and vaccine schedule.
I think that if you strip away parent autonomy, like, what do we have in our provider-patient relationship? I don't think coercion is the key. I think education and helping parents get on the same page is the key.
Hopewell has protocols in place to treat patients if they do acquire a vaccine-preventable illness. Arroyo says they have treated a lot of whooping cough over the past year, even in patients who were fully vaccinated. She says getting tested quickly is important to help stop the spread.